Hello, my name is Richie. I'm the group leader. My matrix number is 23005035.
Hello everyone. My name is ALEYA binti SABRI and my matrix number is 220000701.
Hi there, my name is Catherine and my matrix number is 22086424.
Hi, my name is YIZHU. My metric number is 22090474.
Hi, my name is Amir SYAHMI bin Ahmad HAIRIDAN and my matrix number is 220000911.
So we've got an idea on this anatomy assignment and we are going to delve into adrenoleukodystrophy, which is also known as ALD. But what is adrenoleukodystrophy? I mean, is it related to gene? And what are the diagnoses? And we did some research, surprisingly. Do we have a cure? Or even still, is there even the treatment for ALD? Which surprisingly we have found, and there's also a 85% of successful rate, and we are going to talk about this right now, which we have the key to the problem.
To get a better understanding of ALD, we watched the movie. Let me give a brief introduction of this movie. Lonzo's Oil tells the story of a couple who, in an attempt to save their ALD afflicted son, discovers through their own research a mixture that effectively inhibits further deterioration of the condition, and name is Lonzo's Oil. So, what is ALD? The full name of ALD is Adrenoleukodystrophy. It is a rare inherited metabolic disorder caused by a gene mutation on the X chromosome. If the father carries the gene, then it is inherited by 100% of all his daughters, but not to his son. But if the mother carries the gene, there is a 50% chance of passing it to her children. ALD results in an inability to metabolize very long-chain fatty acid, leading to losing of white matter in the brain and the sensory impairment. Childhood onset of the disease results in death within 10 years. The phenotype of ALD are differentiated between male and female.
Hello, Richie here again to discuss about the brief pathology of adrenoleukodystrophy with you. So adrenoleukodystrophy is actually one of the most common peroxisomal disorder. Peroxisome is an organelle that is obligated to digest fat, but in this case, it failed to do its job. And this will cause the accumulation of very long-chain fatty acid. As the concentration of very long-chain fatty acid exceed a certain threshold, the very long-chain fatty acid will get incorporated into biochemicals, making them fragile. And this will lead to the common clinical phenotypes that I will be discussing now. So one of the common clinical phenotypes is the Addison disease. So the Addison disease means that the patient is lacking adrenal corticosteroid, a type of hormone that is made out of fat. It is very likely that the very long-chain fatty acid get incorporated into it, causing it to denature. The second one is adrenomyeloneuropathy. So this one, it means that the myelin shaft of the neuron get destroyed, very likely because of the very long-chain fatty acid as well. The last one is the cerebral ALD. The cerebral ALD is considered as the most severe case of the adrenoleukodystrophy. It happens in childhood. In 3 to 5 years, the child will enter a vegetative state, which is very lethal and be a major cause of death.
Hi guys, ALEYA is back. As we have learned about ALD, now I'm going to talk about how the diagnosis for ALD is done. The first idea on how ALD is diagnosed is through progressive protocols. First of all, we'll be going through the medical history of the patient for any family history of ALD or death in males below the age of 7. Thus, will conduct a physical examination for any symptoms of ALD. For instance, vision problem, seizures, swallowing difficulties, deafness, poor body coordination, and inability to speak or give adequate response. Then, it proceeds to diagnosis testing where MRI and blood tests will confirm an ALD case. ALD patient's brain tends to show extensive changes in white matter of the brain, especially in the parieto-occipital region, and flare sequences of the internal capsules. On the other hand, blood tests will show a high level of very long chain of fatty acid, VLCFA, a sign of ALD. The second idea is newborn screening. This is an early detection done on babies by taking blood sample from the baby's heel. Blood tests will be done, and if the high level of VLCFA is detected, the baby is to be referred to endocrinologist to monitor adrenal gland function and development of the cerebral disease.
Hi, I'm back again. My name is Catherine, and it's time for some hope for ALD. But facts is that it is said that there isn't a cure. But I always believe in one metaphor, which I believe all of us does. When there is a will, there is a way. But in this case, it is not just a way, but 3 ways. So let's get into it. So there are many ways that we could treat ALD nowadays, but one of it is called stem cells transplantation and also known as gene therapy. So hematopoietic stem cells transplantation is a treatment approach that involves replacing the patient's faulty stem cells with healthy ones. So basically, the success of the stem cell transplantation in ALD depends on factors such as the stage of the disease, the age, and also the availability of a successful donor, which Skyscanner study has said and proven on that. Not only that, in the quest to combat ALD, a rare genetic disorder affecting the nervous system, cutting-edge gene editing technique have emerged as promising avenues for treatment. So the charge is CRISPR-Cas9, a revolutionary tool that allows for precise modification of DNA sequences, which also in vivo HITI in a mouse model, it is proved that increased ABCD1 level and reducing ALD markers. Last but not least, when it comes to N, microvascular and physiological aspects such as blood flow regulation and tissue perfusion plays a crucial role in overall health. So it is possible that studies or interventions addressing microvascular and physiological factors have emerged as potential contributors to the management and also improvement of ALD. But how? So hematopoietic stem cells gene therapy enhances microvascular functions and overall physiological health in CALD.
Hi guys, it's AMIR again. To summarize all of our findings, Lorenzo oil was once a hopeful treatment for ALD, but it has already been replaced by much more safer and effective treatment due to technological advancement. One of the notable alternatives for treating ALD that we would like to emphasize is hematopoietic stem cell gene therapy. Generally, this therapy not only helps patients to cope with symptoms of ALD, it also helps in improving their overall health and is gaining attention in the scientific community. Most importantly, the percentage of success this therapy offers also high, which can up to 85% of improvement in the patient's neurological functions and overall health.